Good morning. My name is Peggy Toy. I'm the director of the Health Data Program. It's a public service program of the UCLA Center for Health Policy Research. We provide training for community data users and other health data consumers. I'll be one of your trainers today. On behalf of the center, I want to thank the California Endowment for its support of AskCHIS and today's AskCHIS training webinar. The California Health Interview Survey is the largest state survey to meet the needs for population-based health data for policy analysis, development, and advocacy, service and program planning and research. Data from the survey is widely available, and we're going to show you free online tools to access CHIS data. These include AskCHIS Health Data Query System, where you can get quick statistics, the AskCHIS Neighborhood Edition GIS search tool, and the COVID-19 dashboards, where you can track COVID-19 and related risk factors. Today's training provides a basic overview of each CHIS data tool and how to use them, how to get data from the California Health Interview Survey of interest to you, and we'll show you how to read the estimates and how to interpret the data. Joining me today's training is Jacob Rosalez, who is the CHIS Data Dissemination Manager. We'll also have a presentation from our community profile data team, Kavya Jawadi, Maggie Shee, Giselle Villanueva. These are third and fourth year students with the UCLA Center for Community Learning, and they'll show how using CHIS data tools demonstrated today can be used to produce data that can be applied to a community profile. These students work in community settings, and the purpose of community learning is to bring academic work enhanced by real experiences with communities. I'm now going to go to the CHIS webpage. We had it here. Here we go. Let's see. Okay. So the California Health Interview Survey is a part of the UCLA Center for Health Policy Research, and you can see at the upper menu that it's on every page on the center's website. I'm going to go into the California Health Interview Survey web pages. And here you can see information on the survey, how it's conducted, and some of the information on survey design and methodology, as well as publications and how to access the data. Today, we're going to show publicly available tools, but there's other ways to access CHIS data. And by clicking on Get CHIS data, you'll see a number of ways where you can access public use files to do your own analysis, as well as confidential data and other information. So I can go directly to AskCHIS. In fact, the address is ask.chis.ucla.edu, but I can just click here on the website, and we can see that both AskCHIS and AskCHIS Neighborhood Edition, I've lost my pointer. AskCHIS Neighborhood Edition are both on this landing page. And when you go to AskCHIS, you'll be asked to set up an account if you don't already have one. That same account can be used to access AskCHIS Neighborhood Edition. Note that AskCHIS Neighborhood Edition is also available in Spanish. So you can see I already have an account here. And so one thing, when you set up your account, we ask a bit of information about you and your organization, and it helps the CHIS team better understand who's using CHIS data and how they can be more responsive to their interests. So now I'll log in. And as we can see on the AskCHIS landing page, we have 5 variables that can comprise our query. That is, ask a question around a topic and population of interest or geographic area of interest. And as you can see, it defaults to the geographic area for the state. And that's our first step in constructing our query. So if we look at the other ways to access geographic areas, we can see that we have regions that are in the way that the state is organized into region with counties within that region. And so we could see northern counties, the Bay Area, Sacramento area, San Joaquin Valley, Central Coast counties, Los Angeles County, and other Southern California counties. So when we select a region, we can include all of the region or some of the sub areas. I'm going to select Los Angeles County. Los Angeles County is the most populous in the state. And it's very similar to the other regions, even though it's a region of its own, because there are smaller geographic areas in which the county is segmented by the health department that helps us to narrow into a local area within the county, similar to the other regions. And so I'll select my county. And when I select next, it takes me back up to our variables. So the next step is to select a topic. And this is a required variable as well as years. And we could see the different categories that are available, topic categories that are available in AskCHIS. I can also do a search. So we can see the search bar here. I'm interested in health care. So when I select that topic, we can see a number of options here. And I'm interested in health disparities. So I'm going to look at the topics in CHIS. So we can see that that search is listed in the far right column. And we see the our topic areas and categories. So we have health status, conditions, cancer, health behaviors, women's health, and so on, health insurance, mental health, and other categories. I'm interested in access and utilization. So when I select access and utilization, we can see that there are a number of topics within this category. Usual source of care, doctor's visits, emergency room use, hospital use, delay of care, and so on. I'm interested in usual source of care. When I select that topic, we can see there are a number of options. So the first question up, and this is often the most used when it comes up at the top of the search, it's have a usual place to go when sick or in need of health advice. This topic is listed in this section as usual source of care. There are multiple years to 2019 and includes all age groups. There are other options here as well. Type of source of care, receives care through telemedicine, and so on. So let's select have a usual place to go. Usual source of care, and we can see that this this topic was in every category, in every year in which CHIS was conducted, and includes all age groups. So we have the results are displayed on the following levels: has a usual source of care or does not have a usual source of care. And when we click on more, it tells us a lot more about this category. It reveals whether or not someone has a usual source of care. And this topic was constructed by using multiple yes or no answers to yes or no questions about having a usual source of care. There is the adult survey, child survey, and adolescent survey. So those those surveys, those who reported that they go to a doctor, my doctor, or identify a healthcare provider are considered to have a usual source of care. It also tells us that there are publications that analyze this data and provided their findings. And you can find publications using CHIS data on the center's website, search for publications. And so we can see from 2001, all through the years, it's been fairly the same way that this topic was constructed. all the way through 2019. So the first thing we're going to do is produce a one-way table, and that means it's also called a univariate table. And the table includes just one variable. So we're going to look at have a usual source of care. So I'm going to click next. So now it asks, do I want to compare topics? And so we're not going to select a comparison topic now, but it does give you an idea of some common comparisons. So if we look at have a usual source of care, you can look at it by those who are currently insured or type of insurance. And on the CHIS website, you'll see the On-Demand Learning Center, where there are videos and technical assistance articles that can help you further understand how to use CHIS data. Also, what are some of the ways that you can interpret the data and understand some of the estimates. And so when you go into the CHIS website, look for the CHIS On-Demand Learning Center. And those links to those resources are in your in the chat box. So we will, you can refer to those after today's training. Also, if you have any questions, you can send an email to the CHIS team and they'll respond to answer your question or send those to who can respond to your question. So, okay, we have our topic, has a usual place to go when sick or in need of health advice. And so we're not going to compare topics now. When you compare topics, that's a two-way table or bivariate table. Again, there's video screening on that, and you can see that within your, on the CHIS site. So, all right, we'll go to next. So now it's asking whether or not we want to limit our population. If we select any one of these variables, age, gender, race, this is the Office of Management and Budget, Department of Finance, it will include only that limitation. You can also limit by federal poverty level. You can't compare with other populations. You'll want to use compare topic for that. So we're not going to limit our population. Also note that the years a variable, it defaulted to 2019 because that's the most recent year that the topic for have a usual place to go or usual place of care is for 2019. But this function will be useful as we move through looking at our estimates and to strengthen the results we get from CHIS. So now I'm ready to get my data. And we can see the chart that's listed here. We can see that we have a usual place to go. And we'll see our estimate here for has a usual source of care. So the first percentage is those of the population that answered yes under this topic. And the estimate is 83.4% of the population responds that they have a usual source of care. And how to read this result is according to CHIS data for the year 2019, approximately 83% of residents within Los Angeles County, our target area, have a usual source of care. And so this is one way of reporting this data, similar with does not have a usual source of care. So how to read the other numbers that's in this cell. So we can see the numbers that are in parentheses. This is a percent, 82% to 84.9%. And this is the confidence interval. This is the range from the from the lower interval to the upper interval, a very narrow range, which means that it is fairly confident that it reflects true values for the population. And so when you're looking at and this is a 95% confidence interval. So if you are looking at utilizing this data, it's a very strong estimate, and it is true to the value of those in the County of Los Angeles, as you'll see with other data that reports this interval, confidence interval range. The lower number, 8 million plus, this is the estimated number of people that will fall within this category of having a usual place of care. And so this gives us an estimate for the number of people in Los Angeles County that would have a usual source of care. So now we're going to take a look at some other tools to have a more robust look at this, this one-way table, this one variable. One thing that we can do is compare by geography, and you can see here that we have some options. We can show geographic areas. So let's say that we selected not just Los Angeles County, but other counties within our geographic area. And our table would show the estimates for each one of those counties, and it would be shown here. In this instance, I want to compare to the state. And as we can see, we have a comparison with the estimate for the entire state of California and compare with Los Angeles County. So you see Los Angeles County is fairly close in the percentage of the population that have a usual source of care. And we can see it's close, 85.9% is not that great a difference. A similar for does not have a usual source of care. So this gives us an idea of a one variable. Do a robust analysis of CHIS data that we can take a look at comparing topics, which was shown earlier. So let's go to compare topics. Excuse me. We could see that, again, some common comparisons. You can look at usual source of care by insured, currently insured, or type of insurance, and so on gender and other factors. We're going to go to look at topics around access and utilization. I'm interested in disparities. So I want to take a look at usual source of care by race, ethnicity. So we have a category called demographic, and it lists a number of characteristics of the population we can select from: age and gender, language, race, ethnicity, family marital status, education, employment, income and poverty, residence in the US, sexual orientation, military service. Again, I'm interested in race, ethnicity, and I'll select that. And as you can see, it gives me a number of options. So we have under race, we have the most frequently used source, which is the Office of Management and Budget for Department of Finance for California, and it shows multiple years up to 2019. And the difference between OMB from the census and the UCLA Center for Health Policy Research, which began its own method in 2007, is that it gives us an idea of different ways of how race is categorized. So I'm going to select race by OMB. We could see those multiple years from the beginning. We can see all age groups that are included. And then we can see the results that would be displayed using this method. We have Latino and then all other racial categories, including 2 or more races, all non-Latino. And when we press on select more, it tells us a lot more how this is constructed. It may be useful in how we might use this particular method of race identification. So in 2001, it gives us fuller explanation. This variable uses the Department of Finance. And in this method, Latino is considered to be a race category for this variable. In other data sources, Latino is looked at as an ethnicity. And within this category, any individual who report that they were of Latino or Hispanic origin were assigned to the Latino category. So in some other methods, for instance, the Center for Health Policy Research and its own method for identifying race categories is when the respondent responds with the race category they most identify with. So we'll select race by Office of Management and Budget. And now it takes us to limit population. So one of the things, because we're comparing populations, we're not going to select limit populations, but if we do, we can see some options here. We can limit by age, gender, and also selecting a specific population from this source. We could use another source for racial categories, and it would give you their listing of racial categories. And then we can also select by federal poverty level, and this includes all poverty level, or we can select a range. But we're not going to limit, we're just going to, because if we want to compare populations, we wouldn't be able to do it in this category because it only shows the limited population that you've selected using these variables for this, for the population. So now we can select data, and let's see what we get. So within this, when we selected get data, a message pops up and it tells us that our query includes statistically unstable estimates. So it's shown by a red asterisk. So CHIS does not recommend reporting this data or relying on these estimates because they're unstable. But it does give us some solutions to stabilize the estimate. We can opt to pool years so that we increase the number, because often if an estimate is unstable, that means there may not be enough representation of that population within that geographic area, or in order to solve that, you might increase the number of years, so increase the number of individuals that are in the sample pool, or you can collapse topics to strengthen the category so you can stabilize those estimates. So let's take a look at some of these options. So one, we can see that we have the denominator is race, and what were the responses to the question around have a usual place to go when sick or in need of health. And so the responses again have or does not have a usual source of care. And we can see that 79%, approximately 79% of Latinos for the 2019 CHIS data report that they have a usual source of care, and so on with the different categories. But again, we see empty cells where there's no data, and then we have a lot of asterisks that are here. And so let's take a look at how we would solve for that. So one way is to increase the number of years in our sample. So when we click on years, we can see all of the years that are, and we could select all years, but I'm going to select the most recent 5 years. Now note that it says compare, and we don't want to segment by years. What we want to do is pool all those years together into a single population. We'll take a look at compare later when we want to do trend data. So now we can get our data. And again, we have all of the topics in place, all the variables in place. Let's see if this stabilizer estimate, we still have unstable estimates. So again, we see, we filled out our empty cells, but we still have unstable estimates. And one of the things you can see is that the confidence interval where we have these red asterisks, there's a wide range. Again, the confidence interval reflects the true value of that percentage and the population estimate for that topic. So our other option is to collapse our compare topic. So remember, our compare topic were racial categories, and we can see they're all listed here. So we want to group together those where we have a smaller percentage. And again, if we want to take a look at any individual population, then we can look at using any of the categories for these populations. I'm going to reset. We want to move American India and Hawaiian Pacific and 2 or more populations. So let's see what we have here. So now we've stabilized our estimates. And another thing that we can do now is take a look at the data in another way. And one of the things is to change our denominator. So we're going to transpose our topics. What that does is it changes the denominator. So then our denominator is the racial composition in the topic of have a usual place to go, a usual source of care. So when we look at it in this way, we can see that Of those who respond, they do not have a usual source of care. Approximately 62% of Latinos respond that they do not have a usual source of care. So within the pool of those answering these questions, Latinos make up the largest percentage of those responding they do not have a usual source of care. This enables us to make some really useful comparisons. So one of the things that we can do is look at charting this data. When we use a bar chart, and we'll see this in the upper left-hand corner of the data screen, we can see that with the bar chart, we can see that Latinos are far more represented in this response. And when we look at does not have a usual source of care, they are at the highest percentage of those reporting they do not have a usual source of care. We can also trend this data. Incidentally, we can do it in a pie chart as well. So it's asking us, how do we want to trend? What do we want to see? We want to see does not have a usual source of care. We select show the trend line. And as you can see, we don't have our trending because we're still pooling our years. So we go back and we compare years. We select compare. And now we can trend the data over time. Now, not all CHIS data will lend itself to trending or these kinds of options. It takes you back to the chart, and that's not what we want to see. We actually want to see a comparison of trending. So in the chart, it still has our unstable estimates. Here we go. Let's take a look at our trending. And we can see that over time, over a 5-year period, that Latinos consistently have higher rates of reporting they do not have a usual source of care when compared to other populations. So one of the things that we can do with this two-way or bivariate table, incidentally, there are tutorials on the CHIS website and the On-Demand Learning Center. We can save to our library. And as you can see, I have 2 other queries that I've saved to my account. We can also export the data into an Excel spreadsheet, email it or print it out. And we could, by exporting it, to insert it into a report that we might do around this topic. So with that, I'm going to turn it over to Jacob, who's going to show us AskCHIS Neighborhood Edition. At the end of the presentations, we'll open it up for questions. And incidentally, in the chat box, you'll see links to the CHIS website, the On-Demand Learning Center, and our survey to tell us about your experience today. So I'm going to stop sharing and turn it over.
Thank you, Peggy. Let me get my screen on real quick. Good morning, good afternoon, everybody. My name is Jacob Rosalez. I'm the Data Dissemination Manager for CHIS at the Center for Health Policy Research. I'm going to be going over using the AskCHIS Neighborhood Edition. It's a little different from AskCHIS. AskCHIS uses direct estimates from AskCHIS survey data, whereas the estimates provided in the AskCHIS Neighborhood Edition or AskCHIS NE, these are modeled estimates. We call them small area estimates because they provide more granular detail on smaller geographies than just counties, zip codes, census tracts, legislative districts, etc. So a quick refresher, you can find the AskCHIS Neighborhood Edition, AskCHIS NE. If you go to the Center for Health Policy Research, you see we have this on the footer. We have this green bar here. If you just click on AskCHIS, it's going to take you right there. You can select that, and the login is the same as for AskCHIS. So once you have an AskCHIS login, it's the exact same username password to get into AskCHIS NE. This here is the landing page for AskCHIS NE. What we have you do is on the left-hand panel here, you have the option to select health topics or health indicators. These are all derived, these are all modeled small area estimates from CHIS survey data. We have some environmental factors, which is from Cal EnviroScreen. It's another data source, as well as sociodemographics, which we pull from the American Community Survey that's provided by the census. So the first thing you want to do when you're going to set up a query in AskCHIS NE is select some health topics or some environmental factors or sociodemographics. I'll just go in here and I'm going to select asthma. I'm going to go with ever diagnosed 18 and older. And you see here that it starts to create your data table. So initially, it just gives you an estimate for the entire state of California. I'm also going to select obesity and overweight. So if I go here, 2016, I go obese, BMI greater than or equal to 30, 18 and older adults. Now I've got two different health indicators pulled into my data table. The next thing that we need to do is we need to add some geographies to this because, you know, we can get statewide estimates from AskCHIS, we can get countywide estimates from AskCHIS, but maybe we want to look a little bit deeper. And also maybe you want to compare and see some comparisons from like zip codes to counties to the state. So if you go up here to the upper left-hand corner and you go to the location option, you select location, and now you get this location pop up. The first thing it's going to do is say search for location. So I'm just going to search in Los Angeles. If I just type in Los Angeles in the search, I get anything that has the word Los Angeles. So you see we have Los Angeles County, as well as we have like the city of Los Angeles. So I'll include those as well. I'm also going to do a zip code. This one is always in my memory, 90210, because I am a child of the 90s. I can throw this in here. Now we also have a find legislative districts. AskCHIS Neighborhood Edition supports California State Assembly districts, California State Senate districts, as well as the congressional districts within the state of California. So if I go here, find a legislative district, we have essentially, you can either do your 9-digit zip code or you can pull in a full address, because some people, myself, I'm one of those people. I have no idea what the geography or what the number is for, like, say, my state assembly district. So you can type in your address and it's going to say, hey, this is all your different districts. I'm just going to throw in this Santa Monica address here and search, and it's going to pull up. And it's also even going to tell you, hey, Richard Bloom is he's the Democratic Assembly District Rep there at 50 and State Senate District 26, etc. So now if I just say I'm going to go with 33rd Congressional District, I can add this to my table. And now what I can do is I can create my map. And you'll see here, we have a pop-up. When you have 5 geographies in there, you're going to get a warning to essentially telling you you have a maximum of 5 geographies to compare. And that's it. So now we can go to create table. It's going to load up. And it's going to load all the estimates in my data table up here, as well as present a map. We see here, this cell is highlighted in orange. So this map is presenting a choropleth of all congressional districts for obesity for adults 18 and older. My specific geography that I have in the table is highlighted. The border is highlighted in the color that it is in the map. So if I do city, if I do LA, the map is gonna change to just showing cities, and it's gonna have a red border around LA. If I do 90210 zip code here, etc. We also have a bar chart here providing us as a quick comparison to see the differences between the state of California and all the other geographies that you have, as well as a trend line to see where the state level is, so you can quickly identify which geographies are above what the state is. As you go into the map, you can zoom in and zoom out by using your scroll bar or using the plus and minus on the map. You'll also notice that we have a tooltip within the map that is dynamic when you scroll around. So as I move around to other districts, I see this is District 37. My estimate is 27.1%, whereas my District 33 is 16.4. So that will dynamically change. We have a demographics panel. If you select this triangle here, it will drop down and it'll show you some information on federal poverty level, race, ethnicity, as well as the population by age and gender. This will also change dynamically as you scroll around the map. we navigate the map, it will change. Sometimes it gets a little wonky and you have to double click. Let me refresh that. Now you'll notice if we scroll down even further to the map, we have a histogram. It flags where your geography selected on the map is, as well as it flags where the state is. You can use this histogram to dynamically filter out any other geographies. So if I start moving this to the side, it's going to start filtering out those geographies. As well as I start filtering this one out, it will filter those out. If I scroll up into the table, if I want to move to the different geographies, simply select in the cell that you're interested in. So if I want to go to LA County and obesity, I select LA County and obesity, and the map will change and it will show me a choropleth of all the different counties. I can begin to hover around and search within the map, look at the demographics panel, and look at the histogram. If you want to move to a different indicator that you have, simply select that cell and the map will change and the choropleth will change. As that is loading, I'll also go over how you can export this information that you've derived. You have an export option. Selecting export, the table will export the data that you have in this data table as a simple CSV file. And then if you want to use that and manipulate it to create your own custom tables or charts, you're free to do that. We also have a map option. This will export your data table as well as your map at the zoom level that it's on as a .png or a .jpeg image. And then you also have a print screen button, which essentially you can either print the table or save it as a PDF. Now that I went over just the simple basics, I want to show something that I think is a real big improvement to this platform, and that is the inclusion of census tracts. Earlier this fall, we updated AskCHIS NE to include census tracts with 2016 data. If you go data earlier in 2014 or 2012, it does not support census tracts, but we now have census tracts in 2016. So if I were to add a census tract, I'll go up to location. And now you see here that we have select census tract option. I'll select that. And we have a map that appears. We'll need to remove a geography, so I'm going to get rid of this 33rd congressional district. Within the map, you can drag around if you know the area that you're looking for. You can zoom in and zoom out to orient yourself with the location. You'll get information such as names of parks, names of neighborhoods, names of major streets and highways. A lot of times, some people don't really know what census tract they're looking at, and most people, myself included, I'm an address person, so we do have an address lookup tool. Because I'm looking at LA right now, and there's lots of great movie landmarks, I figured, hey, let's look at the census tract that has the location of the famous pine tree from that Taylor Hackford epic, Blood In, Blood Out. So I'm going to paste that in here. I'm going to hit the search button or return. It will load. As it loads, I will have a sip. And now we see that my map is plotted on the census tract. It throws a pin where the location of the address is, and it highlights that tract. I can quickly add it by selecting Add Selected Tracts Individually. And now you see here that it's also included Los Angeles County Tract 5309.01. I select Create Table, and the map and data table will begin to load. And now you see it loads and it shows the census tract, my geography of choice is highlighted in gold. And it displays a choropleth of all census tracts in California. So as I begin to zoom out, I can start seeing the different levels. And this is very useful when you start looking at variations in geography for not just obesity, but asthma and all the other indicators. So you get an idea of a more precise idea of where the impacted neighborhoods are, if you may. You'll notice that some of these polygons here on the choropleth have hash marks. It's either because the population is too small. We do not provide estimates for those populations that are below 1,000, or if they have an unstable estimate. As you see here, I'm hovering over it, and in the tooltip it says, this is an unstable estimate. Please combine geographies for a pooled estimate. So let's go into that. Let's talk about combining geographies, because especially with census tracts, you may be looking at a specific neighborhood. It could be something like a Melrose in Los Angeles, or Castro district up in San Francisco. And maybe not one, maybe multiple census tracts actually create that neighborhood that you're looking for. So let's talk about combining geographies next. What we'll do is we'll select the location option up here in the upper left-hand corner. I'm going to remove the tract and LA County. I'm also going to remove 902. Actually, I'm going to remove Los Angeles City. First, I'll talk about combining locations that are counties, zip codes, cities, legislative districts, because it's different than combining census tracts. We select combine location. For this demonstration, I'm just going to go counties. I'm going to combine Los Angeles County and Orange County. So I search for Los Angeles. I select Los Angeles County. I add it over here. And now I need to search for another county. Please note, you can only combine those geographies that are the same. So counties can be combined together with other counties. Cities can be combined together with other cities. Zip codes can be combined together with other zip codes, and census tracts can be combined together with other census tracts. You cannot mix and match combinations. I'll search for Orange County. If I just type Orange, I get this option. So now you see here in my counties selected, I have Los Angeles County and Orange County. I add to current selection, and now it's in my current selection bin. Now I want to do select census tracts. Again, you see this map loads. But you know what I want to do first? I want to create two custom geographies. I want to do a coastal one. Maybe we'll do a bunch of different tracts in Venice and Santa Monica. A simple way to combine your tracts is we have this lasso tool. You can utilize the lasso tool to drag, release it, and it highlights those tracts. Any tract that you want to remove from this selection, just click on again and it will remove it. Now, if I say combine selected tracts, it combines it to the bin and it refers to this combination as census tract group 1. If you hover over the census tract group 1 indicator here, it tells you what tracts make it. Now I also want to include a custom geography by the previous tract that I was looking at. Just to get there quicker, I'll just paste that into the location lookup by address. And it will take me back to this tract. And I'll combine these four together. And now this combination is referred to as census tract group 2. Now I can go and create my table. It will load and be presented in my data table here. And you see I have my LA counties my LA County and Orange County tract geography. It creates a custom estimate for that. My census tract group 1 geography, which is the Santa Monica and Venice Beach tracts. And then I also have my census tract group 2, which is by the previous area. And you also see that a custom polygon of your geography has been created and plotted on the map. I can navigate over to census tract group number 2, replot, create my custom census tract here. I can compare it to the other areas, or I can move over and check out my grouped counties, LA County and Orange County on the map. Again, as a refresher, the number of geographies is limited to 5. The number of indicators, health topics, environmental factors, or sociodemographics is as many as you want. Please keep in mind, you will have if you do more than 5 or 6, you will have a very large table and you'll be doing a lot of scrolling back and forth from your map to your table. But if the purpose of you're using AskCHIS Neighborhood Edition is to garner yield health indicator estimates for these ranging topics and download them as a CSV, you can do them all at once and then simply export to table or map. And that is AskCHIS Neighborhood Edition. I'm certain I've noticed that there's some pop-ups on the chat and the questions. We can discuss those at the end. I'll move on now to our COVID-19 dashboards. So again, at the California Health Policy Research page, we have this green navigation footer. If you go here to Health Profiles and select COVID-19 dashboards, we'll have a page that lists out all of our different COVID-19 dashboards. We have our 2020 CHIS COVID-19 preliminary monthly estimates dashboard. As the COVID-19 pandemic hit, we realized that we needed to add COVID-19 specific questions to the 2020 California Health Interview Survey. As we've been collecting that data, we felt it was important considering the timeliness and of everything with regards to what's going on in the pandemic, and to help those people, help other people, researchers, the public in general, understand the impacts of COVID-19. We started creating preliminary monthly estimates from the 2020 California Health Interview Survey. That information can be found here in the 2020 CHIS COVID-19 preliminary monthly estimates dashboard. We also have a COVID-19 rates and risk factors by California County dashboard. This provides information on COVID-19 cases and deaths by each California county, total, as well as for those counties that provide race and ethnicity COVID-19 cases and death information, that as well, and information on health risk factors that we pulled from the California Health Interview Survey. The COVID-19 rates and risk factors California County table is essentially a table, a tabular view of this dashboard here, without the race and ethnicity data for COVID-19 cases and deaths. And then we also have the Native Hawaiian and Pacific Islander COVID-19 Data Policy Lab dashboard that presents state-level COVID-19 case and death rates for Native Hawaiian and Pacific Islanders in the United States. I'll quickly demonstrate the 2020 CHIS COVID-19 preliminary monthly estimates dashboard. Oh, I'm sorry. So in this dashboard, you'll see we have different tabs. We have COVID-19 treatment, personal impacts of the pandemic, conflict during stay-at-home orders, main reason for not having health insurance, as well as a methodology section that provides information on the data processing and our methodologies in general. You'll see here in the COVID-19 treatment section that we have graphs that provide information from respondents on ever had or thought had COVID-19, contacted health professional about COVID-19 concerns, health professional suspected respondent had COVID-19, ever tested for COVID-19, and would get a vaccine if available. Currently, we have 3 different months of estimates available. If you select on a change monthly estimate, you can either generate May, June, or July estimates. And of course, I get the white screen. Let me see if I can refresh this. My apologies. You can select on a drop down, wait for it to load. Any changes that you make on a filter for one graph will also dynamically make the changes to the other graphs. And you can filter the graphs by different demographic as well as health indicator variables. We have age, sex, race, ethnicity, California region, educational attainment, citizenship status, household status, family type, insurance status, federal poverty level, risk factors, asthma, diabetes, high blood pressure. Filter by race and ethnicity. And you'll get a breakdown by race and ethnicity. You will notice that we have some asterisks and some double asterisk flags. Anything flagged with a single asterisk indicates that it is an unstable estimate. We do provide the estimate, but we flag it as unstable. The double asterisks indicate that it's a sample size, and we suppressed the estimate because the sample was too small. The other tabs in the section work very similarly. They're graphs. And again, you have the choice to change your monthly estimate or filter the graph. Later this month, before the holiday, we will be including some sub-state estimates that will have that will have a map of California and provide some information on this data at smaller sub-state estimates. Some will be for counties, others will be grouped counties based off of the size of the county and how much sample we had. That's all I have for the COVID-19, the AskCHIS NE and the COVID-19 dashboards. I really appreciate your time. I hope you all have happy holidays. I'm going to hand it over to Peggy and the rest of the group.
Okay, we're going to turn it over to our community profile. Thank you, Jacob. With Kavya, we'll kick off how to use these tools to produce data that can inform a community profile.
Hi, everyone. My name is Kavya, and I'm one of the students from the UCLA Center of Community Engaged Learning. And essentially kind of what the students at UCLA are working on is creating, using AskCHIS data to create a profile of a community in Los Angeles and how it was affected by COVID. And we're specifically focusing on the Latinx population because the Latinx population is the largest ethnic group currently in Los Angeles County. So what we have here on my screen is another COVID-19 dashboard. And right here we have the statewide COVID-19 numbers and rates by race and ethnicity. And at the bottom, we have the countywide COVID-19 numbers and rates by ethnicity. And as we can see here, the Latinx population has one of the highest infection rates of COVID in Los Angeles County, other than the Native Hawaiian Pacific Islander kind of population. And that's gonna, since we can conclude that this the Latinx population is disproportionately affected by COVID, we're gonna look into some more factors about why that's true. So now if we go to the COVID-19 preliminary estimates that Jacob previously looked at, and once we click the personal impacts of the pandemic and filter by race and ethnicity, we can see that one of the significant pieces of data is that when we looked at switch to working from home in, sorry, looks like it's reloading. Let me just go back to where we previously were with the personal impacts of the pandemic and then filter it by race and ethnicity. We can see that that in California, the Latinx population, only 17.6% were able to switch to working from home. This is significant because it's considered a privilege to be able to switch to working at home. And if you're able to switch to working from home, that means you're at a much lower rate of getting infected or contracting COVID-19. And another piece of significant data we can look for in the COVID-19 dashboard is the financial difficulties with basic necessities. And we can see here that the Latinx in California, 13.6% of the Latinx population struggles like with financial difficulties with basic necessities. And that's a lot higher than, let's say, compared to the white population, in which it's only 5.4%. These are both significant. This is also significant because without access to like basic necessities, that puts you at a higher risk of COVID due to other factors such as being able to like overall health, to be able to buy proper kind of nutrition for overall health factors, and just having access to healthcare. And here we actually have a graph kind of like of outside data, and it's actually comparing the income and the ability to stay at home during COVID-19. And this graph is divided into different quintiles based on income. So the purple is representing the lowest 20% of incomes, and the yellow represents the highest 20% of incomes. And we can see here that this is where the pandemic hit, that the lowest 20% owners, lowest 20% income are the least likely to be able to switch to completely working at home, while the highest 20% of earners are the most likely to actually have the luxury of staying at home. And as we saw previously in the COVID dashboard, with the Latinx population kind of having the greatest trouble meeting kind of financial necessities, we can come to the conclusion that they're disproportionately represented in this kind of purple line, and the data about the Latinx population being less likely to be completely at home kind of corroborates with this graph. And so now we're going to go back to this COVID dashboard and just look at some of like the other health and sociodemographic indicators that might be implicated with COVID-19. First off, we're going to look at the healthcare access and utilization, which is definitely important when we're looking at COVID-19. And then here in the COVID dashboard, you can actually just press the county that we want. We're looking at Los Angeles County, and get the information right here. And we can see here that in Los Angeles County, 54.3% of the Latinx population actually had delayed medical care due to cost issues. And this is compared to only 38.4% of the white population. And delayed care due to cost means that has implications with COVID, definitely, because that means that people are less likely to get treatment with COVID-19 and may only kind of go to the hospital and get care when the symptoms are a lot worse and more severe. Another important indicator to look at is the usual place of care. And we can see here that in Los Angeles, only 77.1% of the Latinx population has a usual place of care compared to the 91% of the white population. And usual place of care is a big indicator of just like, first of all, overall kind of trust in the medical system, as well as just an indicator of just being able to financially kind of get health access resources. And finally, it also kind of looks into like the overall kind of general health of a person. If people are less likely to have a usual place of care, they're less likely to have like an overall kind of better healthy outcome. And this is significant because the literature and other studies have shown that having other health issues can kind of increase the kind of severity of if you contract COVID-19. And kind of building off that point, we're going to look at some like other pre-existing kind of like health conditions. And we can see that in Los Angeles, 35.4% of the population, of the Latinx population, has obesity, compared to just 22.1% of the white population. And we can see sort of a similar trend regarding diabetes, about how in Los Angeles, 12.1% of the Latinx population has diabetes, compared to just 7.6% of the white population. And so using both of those data, we can come to the conclusion that the Latinx population disproportionately has kind of worse overall health, which can lead to the certain COVID infections becoming more severe and leading to greater chances of death due to kind of COVID. And so basically we can use all this information to arrive at our kind of research question that we're looking at, which is how has the Latinx population in LA County been affected by COVID-19? And what are the factors that have led to the Latinx population being disproportionately affected by COVID-19 in certain LA communities? And now with that, I will hand it off to Maggie, who will be using AskCHIS to kind of go into more depth about this question.
Hi, everyone. Thank you, Kavya, for the introduction. Now I'm going to be using the AskCHIS tool to look into some of the factors that Kavya talked about and to look at some actual data that I can get from the survey. And so here I've already logged in. And so this is the home page. Right now it's searching all of California, but since we're focusing on LA County, I can scroll down here and just select LA County. And then I'm going to, oh, I guess it logged me out. So let me just log in again. Okay, and so I'll go down to LA County. And the first topic I want to look at is main type of work or occupation, because like Kavya had mentioned, having a job that requires you to be outside or interact with other people puts you at greater exposure to the virus. And so we want to look at different occupations and how this changes across different races. And so to do that, first I'll choose main kind of work / occupation. And then I can compare this to race. And so I'll go to demographic again, race / ethnicity. And I don't want to limit the population. I just want to look at everyone. And so here you can see some of the topics are statistically unstable, and that's because the sample size might be too small. And so to solve this, I can either pull more years or I can actually collapse some topics. And so I already did this. If I go to this tab, you can see I've already collapsed the compare topic. So I've just left Latinx, white, and then I've kind of pooled all the other races together, and same with these occupations. And actually what I'm going to do is I'm going to export this to an Excel spreadsheet so that we can look at this in Excel, because it's kind of easier to look at all the data that way. And so let me open that up. Oh, okay. And so this, it's kind of long, but I can just go over really quick the different categories that I've pooled the occupations into. And so I separated healthcare because that's kind of an in-between occupation where you have to be out in the field and working, except that's you also kind of have PPE. And so that's not exactly what we're focusing on, but the other two categories are like management, computer science, education, sales, and office jobs, which are relatively easier to switch to stay at home or work from home. And the other category is service, construction, installation, maintenance, production, transportation, and others that require you to constantly be outside or interacting with others. And so we can see for the Latinx population in LA County, more than half of the population works in the second category or the third category, whereas for the white population, only about 20% do. And even compared to the other pooled races, the Latinx is still much higher. And so we can see that from this, like this tells us that based on just the occupations that people hold, the Latinx population is already at greater risk of getting the virus just because they have greater exposure from their jobs. And so now I'm going to go back to AskCHIS. And now I'm gonna go to SPA 6. So I'm gonna go back to geographic area. And here you can see that there's this second tab that lets you choose from LA County spas. And you can look at the map and see where the different spas are. I'm gonna click Spa South, which is the same as Spa 6. And the reason why we're focusing on Spa 6 is because it has 68% of the residents are the Latinx population. And according to the LA County Department of Public Health, the spa also has the highest percentage of adults who are currently uninsured and the highest percentage of adults who reported difficulty accessing medical care. This spa serves the communities of Athens, Compton, Crenshaw, Florence, Hyde Park, Linwood, Paramount, and Watts. And later, Giselle will actually be using AskCHIS Neighborhood Edition to be looking at Linwood specifically and surrounding communities. So first, we're just gonna look at SPA 6 as a whole. And so I can select South. And I'm gonna look at main kind of work / occupation again, but this time I'm not gonna compare it to race because since the majority population is Latino, there's not really enough of a white population for me to get data on. So I'm just gonna limit the population. And so some of it is statistically unstable again. I can either pool years or collapse topics. And so I'll collapse topics again, which I already did here, and I'll export this. And we can look at it in the Excel spreadsheet. And so looking at just SPA 6 alone, we can see that the percentage of people that are of the Latinx population that are working in the third category of occupations is even greater than what we saw in LA County. In LA County, it was about 50%. In SPA 6 alone, it's around 64%. So, and yeah, even for healthcare, you can see it's statistically unstable because there's just such a small sample size. And so this again just reinforces the idea that not being able to work from home does have a big impact, and having this exposure really puts people at greater risk for getting the virus. And so now that we've looked at work and occupation, I'm just going to look at one last topic. And so now I want to go back to access and utilization of healthcare, because we had previously talked about how the Latinx population has a higher percentage of people that delay medical care. And so I kind of want to explore why that is. So if I go to access and utilization, delay of care, and I can scroll down to main reason delayed or had forgone needed medical care, and then get data. And so this time I'll pull a couple years. It's still a little, oh, oops, I was accidentally comparing and not pulling, so that's why I was doing that. Okay, and so now the data is stable, and we can see, like Kavya had shown us in the COVID-19 dashboard, more than half of the population that said that they delayed or had forgone medical care did it because of the cost or lack of insurance or other insurance-related reasons. Around 24% because of healthcare system provider issues and barriers, and 21% for personal reasons. And so we can see that there are definitely many barriers in the healthcare system and also in obtaining insurance and costs that prevents populations from receiving medical care. And this is also, this plays an impact in the pandemic, because we want everyone to be able to get treatment if they contract the virus. And right now, looking at this data, we can see that not everyone has that opportunity. And so that is all for AskCHIS. And now I will hand it over to Giselle, who will talk more about AskCHIS Neighborhood Edition.
Thank you, Maggie, for showing us Spot 6. Really helpful. I'm gonna share my screen now. Oops, where is it? So now I will use AskCHIS Neighborhood Edition to create a local community profile. We have looked at health disparities in the Latinx population across the Los Angeles County. Now I am happy to present CHIS data in Linwood, the community I grew up in. Linwood is a low-income community with the 89% Latinx population, which resonates with previous findings. I volunteer for the Linwood Community Center, and just recently I was able to provide COVID-19 resources to residents in Linwood. Through my observations, this tool can help shine a light on the health disparities a community like Linwood is experiencing with the Latinx population at higher risk and poor in health outcomes. I'll be looking at different factors that make Latinx individuals in my community more susceptible to COVID-19, such as education, very poor health status, obesity, and the uninsured variables, to highlight how these disparities affect the Latinx population. So now I'm gonna look at the social demographics. I'm gonna select education, and I'm focusing on 18 plus population. So now I'm gonna select my health topics. I'm focusing on health status, and obesity, and the last one would be the uninsured category. Okay, so now I'm gonna select my geographies. Okay, I'm focusing on Los Angeles County, Linwood, and a neighboring city, I'm gonna look at Cerritos. Okay, now that I have selected, I'm gonna create my table. And there you go. Here, for my education, the less than high school category, we can see that that education is very high when we're looking at Linwood compared to other geographies such as California, Los Angeles County, and Cerritos. The reason why this is important is because educational attainment is one of the most important determinants of individuals' lives in terms of employment, income, housing, and health status. So this is why many of these other indicators might also be affected, as we could see here. So now I'm going to show the graph, so the map, so we could see Linwood. So this is Linwood right here. And let me just show some demographics. We could see here that 38% of Linwood is living under the federal poverty level. And then when looking at, let's say, the city that I picked, Cerritos. Oops, yeah, there you go. We could see that Cerritos has a lower federal poverty level when compared to Linwood. And what's important to note here is that Linwood and Cerritos are very close from distance. There's just 2 cities in between it, but yet we could see the difference in like the health disparities between these 2 cities. So right here is Linwood, and then just right here is Cerritos. So that's just one key thing to know. And also looking at, let's say, the currently uninsured category, we could see that Linwood has 20.8 percentage estimate, which is the highest when looking at the other geographies. And in particular, looking at Cerritos, we could see that it is much relatively lower than Linwood, as it is 8.1 percentage when compared to Linwood as 20%. So we could see here that not having health insurance leads to poor health, especially now as we are in a global pandemic. We need more resources and accessible health insurance, and Linwood is just highlighting this. So now looking at the same thing for federal poor health, we could see that Linwood is significantly more impacted in terms of like the estimates here. And then one key thing that I found here as well is obesity. When looking at obesity, Linwood has a 42.5 estimate when compared to, has much higher estimates when looking at the other geographies such as California, Los Angeles County, and Cerritos. And here, based on like my observations as a Linwood resident, possible reasons for the high percentages of obesity can be due to the lack of green spaces, lack of farmers market. There are many unhealthy food options such as fast foods, liquors, 7-Elevens throughout this community that could possibly be the reason for these high estimates. And now looking at that, I want to dive more into my census tract. So I'm gonna eliminate Cerritos since I wouldn't be using that anymore. And also, yeah, I'll take off California. So now I'm gonna select my census tracts. Okay, so here is I wanna look at the neighborhood around like the community center, the Linwood Community Center that I mentioned earlier. So I'm gonna search this real quick. Yeah, so I want to look at the neighborhood around the community center, which includes like high schools, the hospital services and programs that serves the Latinx population, and see if there's like any difference than Linwood. So I'm gonna use the lasso tool to just grab on these high schools and other buildings. There you go. Oh, I want to look at these as well. This one. And yeah, maybe this. Okay. So now I will combine my selected tracts. And there you go. There's my census tract group 1. So now I would create the table. Oh, okay. So while my map is loading, there you go. See right here below, we could see this is my census tract. So it includes Linwood. It includes the community center around like Linwood and possibly some of East Compton, but it's very similar. Compton and Linwood have very similar characteristics, so it wouldn't make that big of a difference. Okay, so here for these health indicators, we could see that the percentages aren't so different in my census tract, but in terms of like the population, we could see a difference. For instance, here in Linwood, for the currently uninsured, the 45,400 of 20.8 are affected. And then looking at my census tract that dived into a more specific community around the Linwood Community Center, we could see that it has impacted a greater population, which versus here it was 45,400 and over here it's 50,700, and it shows the same for the rest of these health indicators. So yeah, I want to conclude with one recommendation is that we need to focus on like communities of need versus, you know, first come, first serve. And Linwood demonstrates this. And also Linwood is a community that is impacted with significant underlying health conditions, socioeconomic barriers. They're not able to guard against COVID-19 due to occupation, crowded housing, and the lack of health insurance that enables them to get the information and care they need to overcome COVID-19. Linwood should be a priority for public health interventions, as we saw the lack of accessible resources this community has to offer children and families. So therefore I am going to share this data with my community centers so that they can use it and argue for the needs of my community, Linwood. So thank you. I would now hand it off to Peggy Toy.
Thank you. Thank you, all the presenters. Great job, team. So now we're going to take questions. And if you've entered your question within the Q&A, I'm going to open up for some of the questions here. Jacob, or if you're still with us, I think some of these questions are for you.
Yes.
So I'll start off on the first one. There is a question regarding quality of adjusted life years using AskCHIS data. And the question is, how would we go about obtaining general data from AskCHIS regarding quality of adjusted life years comparing age groups 25 to 34 and 55 to 70?
So we do not have any quality estimates in AskCHIS. So I think what you're going to have to do in there is just kind of go through the platform and I'm sorry, but it's been a while since I've done anything with quality. But go through the platform and search through the different topics to see those topics that might be a little bit more general, that may have that may go into deriving a quality. But you can search by different, so you can compare topics by different age groups and collapse, as well as you can also filter down, so you can make it specifically to a specific age group within your queries. But as far as having an estimate for a variable that is quality, we do not support that in AskCHIS.
Right. You may be interested in accessing CHIS data directly to do your own analysis based on the measures that you're using to measure quality of life for those population groups. But for rapid access, AskCHIS, you'll look at the variables to see which one fits the measures you want to make around quality of life. Our next question is from Diane Gonzalez. Where can I find information detailing methods used to scale down the census tracts? And will other I think, dates be available
Yes.
soon for smaller area estimates?
Yes, so we will have 2018 small area estimates. We're working on modeling them right now currently, and they will be available. We're shooting for February 10th of 2021 to have those up in there, and that will include census tracts and all the other geographies that are available in AskCHIS NE. As far as the getting information on the methods, we do have on the main landing page, we have a learn about methodology, a help section, and so if you want, actually, you know what I'll do is I will just share it with you to show you exactly where it's at. I did touch base with our IT people, and there's something kind of wonky with it, so you won't be able to access it currently, but they're working on it to get it. So you could learn about methodology. For more information about the methodology behind our data, click here, or the help section. There's some odd bug with it. They're working on it. It should be taken care of by the end of the day.
Okay, thank you. I have a question here from Catherine Hayward, and this one I can answer. It has to do with the AskCHIS. Is there a way to find data for disability communities, physical, intellectual, and so on? If not, how do I approximate if you need data on people with disabilities? So one thing that you can look into AskCHIS under health status, and it does list different types of conditions that are listed for disability, and I'm looking at it. This is a disability or illness due to injury, physical, mental, or emotional conditions, blindness, and other factors. So you want to take a look at the health status category in CHIS and to select which disabilities you're interested in. And I think we have most of the questions. Some were withdrawn. If you have additional questions after today's webinar, please contact CHIS. And I think that the email address is going to be posted in the chat. And also, if you'll stay to complete our survey telling us about your experience today, it will help us as we look forward to providing more trainings in the future. We ran a little over, but we appreciate your joining us today. And also look at the CHIS website to see tutorials in the On-Demand Learning Center, as well as publications and more detailed information about how to get CHIS data, how it's analyzed, and publications that have used CHIS data for findings on specific health topics. And with that, if there are no more questions, Tiffany, are there any others coming from the chat?
It looks like there's one other question from Jose Santiago Velez. Does the
I see that,
tool?
yes.
Okay. Do you want to read that one or?
Oh, does the tool have the capability of combining health-related factors to produce a sort of vulnerability index map by county or zip code? Jacob, that's for you.
No, we currently with AskCHIS NE, there's no way it doesn't support combining the different health factors to create a custom calculation. The only thing it'll do is it will, as far as like kind of like a more custom calculation that it will develop is when you combine your geographies, it will create a new kind of aggregate estimate based off of the combination of the geographies. But as far as combining multiple indicators or multiple sociodemographic variables that it has, it does not do that.
Thanks. We have one more question from Lillian in the chat. It says, California has the largest AIAN, which is American Indian Alaska Native population, but it appears that CHIS data captures too small a population for analysis. How do we import that?
So if you look at, the center is working towards disaggregating data so we can see more populations that fall within larger racial categories. And so if you look at the race ethnicity category, you'll see some Asian population groups where you can identify topics that are pertinent to that population. And the other thing is you'll often find a small geographic area may not work for a stable estimate. So you may have to increase your geographic area to produce a stable estimate for specific Asian populations. Jacob, do you have anything more to add about that in regards to the specific Asian population?
She's actually referring to American Indian, Alaska Native, but I think
my apologies.
I think one thing to consider is to pool your data. And it might be, you may run into the issue where if you're trying to get a county estimate, you may just have instability. Another option that you can have, and I'm going to share my screen real quick and show you, because this may be useful, it may not be. Let me just go to AskCHIS real quick. Show you what one thing I would do is if you go in your topic section and you focus on demographics, so like where it has the demographics and it's, you have race, OMB race and ethnicity, census race and ethnicity, etc. You have the option to also look at specific race ethnic groups, any mention of. And I believe we have that for American Indian, Alaska Native. So we do have, let me see. Okay, so here we have any mention of American Indian, Alaska Native self-reported. And so this is if, as they go through the CHIS survey, they're asked a wide range of questions. They're not just asked, like, what's your race and ethnicity? They're asked, are you Hispanic or Latino? Or, or when they ask the race question, they say, what is your race ethnicity? And if they have any mention of saying I'm American Indian, Alaska Native, Native American, etc., and this, that, and the other. So this is one way to try to, you may be able to get more sample to get a more meaningful estimate. Again, this, when you're looking at AIAN communities though, then it's like, you may have the issue of like, is this someone that's enrolled with the tribe? Is this someone that maybe they did a DNA test and they found out they have like 0.001%. So it's hard, it's really hard to derive that. So I think this is one option to use. I think another one is to definitely pool your data to try to get more stable estimates, as well as I think there's certain areas that you may be looking at where it's just the population isn't low. I always think of, one thing I try to do is I look at like where are there a lot of tribes and a lot of reservations. So like for myself, I think I'm gonna, like if I was to do something on AIA, and I'd focus on San Diego counties, Orange counties, Riverside, etc. Those areas that do have a larger population. But we definitely do recognize that sample is an issue when you're focusing your analysis on AIAN.
And one other quick thing to mention with the data disaggregation is we're actually, the National Network of Health Surveys, which is part of the UCLA Center for Health Policy Research, is offering a series of workshops designed to improve the disaggregation of race and ethnicity measures in health data sources. And we've got a couple workshops, one coming up on December 15th and a few more in January. So if you're interested in learning more about that, if you could email us at healthpolicy@ucla.edu, we can send you more information about those workshops.
Okay, so we're going to close our webinar today. And I just want to show you that, oops. So again, you can visit the CHIS website to get more detail about CHIS. The AskCHIS On-Demand Learning Center, which you'll find on the CHIS website. And any questions or technical assistance with using any of the tools we showed you today, you can write the CHIS team at chis@ucla.edu. I also want to thank all of our presenters today, and Ninez Ponce, the CHIS Principal Investigator and Director for the Center for Health Policy Research, and Todd Hughes, the CHIS Director. And we want you to tell us what you think. Please complete our brief survey. It should come up when you exit. We appreciate your time today and would love to get your feedback. Thank you, and thank you to everyone on the team for today's webinar. With that, we'll close out the webinar. Thank you.